vocabulary that was there, and the vaginal ring which we are using. So arrival of Len has caused a lot of excitement in the public, whereby people have been thinking that this is a magic bullet. But as a ministry, we are saying this is one option. We promote choice of all HIV prevention interventions under combination prevention. And under combination prevention, we have the behavioral interventions, we have the biomedical interventions, we have the structural interventions. Uganda, landmark, known for ABC strategy or prevention interventions. That is abstinence, behavior change, or be faithful, and condom use. That worked for a very long time, including all actors, the church, the media, the public, individuals, and we managed that time in the 90s to bring down HIV from a 2-digit, around 32 to 18%, to now the current 5.2%. However, the ABC strategy was criticized because of the community we live in, the culture we live in. Some women are raped. Some women are forced into marriage. So you cannot tell a girl forced into marriage to abstain or to be faithful when the man is not faithful. So in addition to that, we have combination prevention, biomedical. You can use a condom, you can do circumcision if you're a man, or you can use the ARV-based interventions, which have the PEP, PrEP, and PMTCT. But also treatment itself, HIV treatment itself, is prevention. Because when your viral load, when you're treated and your viral load goes down, then it means that your capacity to transmit, or your probability, your chances of transmitting is lowered. So all these interventions are very important. Then we have the structure. The structure are basically tackling things like laws, human rights, gender-based violence, those negative cultural norms like marrying off women early, like in some practices where some cultures circumcise and say maybe you have to sleep with an old woman to heal, or where people have the twin dance and the like. So all that response is what we call combination prevention, and we promote all of it in its entirety, not just one-off. Now, currently, the ministry, because we are biomedical, we seem to promote the biomedical interventions most. Prevention, that is the ARV-based prevention, and also the condom use and the VMMC. So coming back to your question of LEN, which is the new intervention, LEN now is very expensive. One dose, and it's expensive and restricted. Not any country, not any individual can go and buy LEN. It is still generic. It has not yet been branded or produced by other manufacturers. So right now the dose is still very expensive. It is $10,000 per dose. But what we are getting in the country is through donation. And through donation, they have reduced the cost to around $60 per dose. But it is not, and it is going to come down to around $30 soon. But it is not sold to everybody. So for now, all we can do for sustainability is to have as more advocacy locally and internationally to the manufacturers and to the duty bearers, such that the price can come down through branding, such that other manufacturers can also produce it, but also through donors subsidizing on the cost like it is now. So through that, we shall be able to reduce the cost. For now, most of the governments cannot afford the LEN in its current state. And the government is already constrained with many other interventions. We have to buy condoms, we have to buy other ARVs for treatment, we have to pay taxes, to pay salaries for health workers. You have seen how the interns are struggling. So with all this on government, it's unlikely that government can go for something that they assume currently is not as sustainable like other interventions. Yet they are also very effective, like the condoms, like the ABC, which is promoted in this country, and also the other PrEP options. So, but as a country, and that's why we stick to promoting choice, so that somebody can use any intervention that fits them based on your needs, and also that is preferred by that person, not just the want. Right now, everybody wants Len, but maybe it's not what you need. Maybe you need to abstain. Maybe you need to be faithful to your partner. Maybe you need to use a condom. Maybe you need to use PEP. You're already exposed. Maybe you need to be on ART treatment. So all those other options, government has to look into them before we rush for a very expensive option which is new on the market. And soon we are going to have the oral tablet for PrEP. So shall we again shift all our effort to oral tablet? So it's better we promote the entire system as a whole for the response. Thank you so much.